Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 126,848 confirmed cases of COVID-19 in Canada and 41,813 cases in Ontario. Chatham-Kent has 362 cases and Sarnia-Lambton has reported 338 cases. Michigan now has 99,958 cases, with 13,544 cases being in Detroit. Today, we are reporting 2,493 cases of COVID-19 in our community, an increase of 4 new cases from yesterday. All 4 are close contacts of a confirmed case. 2 are healthcare workers. Overall, 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. 2,357 cases are now resolved, and 64 cases are currently active and being followed by our health unit. 6 people are in the hospital and 1 person is in ICU. Our community has lost 72 people to COVID. 50 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID outbreak. As well, there is 1 outbreak in an agri-farm sector and 1 in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Windsor-Essex will soon have 3 COVID-19 assessment and testing centers. Currently, we have 2 sites, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates.
Good morning, everyone. Thank you again for joining us today. I'm glad that I didn't mess up the numbers this morning. Before I get into our EPI summary, I just wanted to talk about an alert that we will be issuing later today. There is a potential for public exposure at certain locations. As a precaution, the Windsor-Essex County Health Unit is notifying the public of a potential exposure to COVID-19 on August 21st at the following establishments: Winology Restaurant, 19 Main Street, Kingsville; El Diablo Restaurant, 16 Main Street, Kingsville; and Muscadere Vineyards, County Road 18, Harrow. We have identified the 2 individuals symptomatic for COVID-19 and recently confirmed positive visited these establishments on August 21st. The Windsor-Essex County Health Unit is working with all close contacts identified through case investigation and contact tracing. While the risk to other patrons is likely low, the Windsor-Essex County Health Unit is notifying the public because there is a potential risk of COVID-19 exposure to the customers who visited these locations on these specified dates. Individuals who visited Winology, El Diablo, or Muscadere Vineyards on August 21st are being asked to take the online COVID-19 self-assessment, monitor symptoms, and if any symptoms develop, contact their primary care provider or go to an assessment center. We believe that the potential exposure to these customers is likely low. However, the risk for infection remains. I know we state this every morning during our YouTube live session, but it is critical that if you are feeling unwell with even the mildest symptoms, please stay home. If you are someone who attended these locations on August 21st, please monitor for signs and symptoms of COVID-19, take the online assessment, and contact your healthcare provider. I'll now move on to our epi summary for this week. So very quickly, this is what we will cover. We will not be covering at least a few slides that we normally cover because of the migration of our database into a newer system. Most of the information that you will see, we're comfortable sharing that information, but there will be some slides that will be missing in today's presentation. As we always say, that epidemic curve helps to assess the progression of the disease, whether we are talking in the community or in an outbreak situation. And this particular epi curve is created to show the number of confirmed cases of COVID-19 by date it was reported to us. And on your vertical axis, you have the number of confirmed cases. On your horizontal axis, we have the dates that these cases were reported to the public. These figures includes all cases. That means cases in the community, long-term care home, retirement home, as well as the agriculture farm sector. We also know that day-to-day variation can vary significantly, and since COVID-19 does not cause immediate infection, immediate disease after exposure, and in order to minimize the day-to-day variation, we try to look at the data in a 3-day moving average. The 3-day moving average is help to capture some of the day-to-day variation and try to paint a much better consistent picture of how things are going in our community. As we can see that we have seen some significant spikes in the month of July, which is now trending downwards and relatively stable as we have moved into the month of August. This particular graph looks at the cases in the agri-farm sector versus non-agri-farm sector by reported date. The agri-farm cases are indicated in the green line, and the rest of the community cases are outside of the agri-farm cases are indicated in the blue line. As we can see that we have seen significant activity during the middle of the month of May, end of May to all the way up to end of July. But now these cases in the agri-farm sector is going down significantly, while the rest of the cases in the community continues to remain in the stable position. This graph looks at the cases that present to our emergency department at Windsor Regional Hospital and Erie Shores Healthcare with symptoms related to COVID-19, such as cough, fever, pneumonia, and many others. The green line is the current year, 2019-2020 season, which starts in September 2019 and goes until the end of August 2020. We are currently in week 35. The blue line is a 2018-29 number as a comparator. As we have seen in previous presentation, we have seen a large number of cases showing up at the emerge in the month of March. We have seen some spike later in the month of beginning of July, mid of July. It has started to trend down. We have seen some spikes as we have worked through the rest of the season. Focusing specifically on the Erie Shores Healthcare, we created this particular curve to show some activity with respect to migrant farm workers in the Leamington-Kingsville area showing up in the emergency department. So it's another indicator that we try to keep a close eye on. And as we can see that we have seen a significant spike, but that spike has gone down. And there are some indications that there were people who are showing up at the emergency department, but generally it's relatively getting into the stable direction. This figure looks at all the tests and unique individuals tested by week in Windsor-Essex. In total, 79,759 tests were completed, and 51,463 unique individuals were tested as of August 22nd. Looking at all tests last week, our current percent positivity is 0.8%, that orange line. If we are looking at unique individuals that tested positive last week, this is closer to 0.6%, which is the red line. Last week, approximately 545 tests were completed daily, and 538 unique individuals were tested daily, which is an indicator of how we are doing in the community with respect to testing. Another way to look into the cases and moving average by looking at a 7-day moving average to look at our overall trend. The blue line looks at all of our cases using a 7-day moving average. We see a peak in late March and in April, and then the later is attributed to the outbreaks in long-term care and retirement home. We have seen a significant increase in the middle of June all the way up to July, but now we're looking at a downward trend, and overall the green line is the moving average when we are removing the agri-farm sector. Overall, now we are seeing that the both lines are touching each other, which means the cases in the agri-farm sector is also declining and subsided, and it's fairly comparable, below 5 cases as an average, which is a good indication as an overall community. So this slide captures the week-over-week incidence rate per 100,000 population from week 18 to our current week. We saw a dramatic increase in cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector. We are now seeing a continued decrease as of week 35. Please note that week 35 is still in progress and it ends on Sunday. Windsor-Essex continues to have the highest rate in the province, and our rates are higher than many of the other health units. For us here locally, we have seen significant increase due to our large number of cases in the long-term care home, retirement home, and in the agri-farm sector, which contributed to most of our cases. Looking at the case rates by each of the municipality, Leamington and Kingsville continue to be the highest rate of COVID-19 per 100,000 population by each of the municipality, while LaSalle presents with the lowest number of cases by per 100,000 by municipality, while the rest of the region is fairly consistent with their number of cases per 100,000 population. This map displays the rate per 100,000. This map displays the rate per 1,000 residents by dissemination area. The areas with no colors are places where there have not been any lab confirmed cases of COVID. These cases are up to August 27th. Please note that the scale is used from 0.5 cases per 1,000 to 371.6 cases per 1,000 population. The scale will change in each map and is a relative comparison to the cases in each geographical distribution. As you can tell from the previous slide, in Leamington and Kingsville, the darker colors, blue and purple, indicate higher cases in those specific dissemination areas. Relative to the county, rates are low in the city of Windsor. Yellow or lighter version of yellow indicates low rates of COVID in those specific area. Please note that this does not mean that these are where the cases were acquired or infected, rather where they reside. Cases may have been exposed to COVID outside of their home, but in this map, it's only mapping based on their home address. Zooming into the city of Windsor by the rate per 1,000 residents. Once again, areas with no color are where no lab confirmed cases were identified, and these are also the cases that are reported up to August 27th. As described in the previous map, this map is comparing the cases only in Windsor, and the scale in this map is from 0.8 cases per 1,000 to 27 cases per 1,000. And as we can see, certain pockets had higher rates across the city, while many of the city areas did not have any case of COVID. Looking at just the active cases in Windsor-Essex, this map looks at that, and as expected, the rates are higher in the areas of Leamington and Kingsville predominantly in the past, but we are seeing a change, and most of the region in Windsor-Essex is showing minimal or no active cases in the area. Zooming it further in the city of Windsor, this is what it looks like, and again, these are all the cases up to August 27. What we can see is the rates are very low compared to the county, but within the city of Windsor, their rates are high in certain pockets. And please note that this again does not mean that these cases were infected. Instead, it's just a function of where they live. So overall, looking at the age and sex distribution of our cases, male continue to be dominated by the large number of cases in the region, whereas in terms of the distribution by age, it's not very different. It's spread across evenly, with majority of the cases in the younger population between the ages of 20 and 29, and all the way some changes with the 30 to 39 age group. We have seen more activity more recently in between the 20 to 29 age group. So overall, looking at the distribution of cases by municipality, we can see that Windsor, Leamington, and Kingsville continue to be the the largest region where we have most of our cases, with a similar number of cases in the rest of the municipalities. Zooming it further, in the last 30 days, we have seen almost half of these cases are from Leamington, whereas a quarter of these cases are from Windsor, followed by Kingsville, and the rest of the municipalities have low activity of cases in the last 30 days. Focusing just on the last 7 days, this is what it looks like. Leamington continues to be showing half of the cases in Leamington, whereas LaSalle is showing 27% of the case, whereas Windsor continues to be one of the other region with large number of cases, with 18% of cases, while the rest of the municipalities are showing no cases to few cases in the region. Focusing on the occupational status, as we can see that overall in the last 7 days, we have agri-farm workers contributed to 8% of the cases, healthcare worker constituted 8% of the cases, while the rest of the group is either missing or retired or unemployed. So this particular graph looks at the epidemic curve for each of the municipalities, as we promised that we will share these cases, epi curve by each of the municipality. And I understand that this is not updated on our website yet, but we plan to do that. There are some changes, as we have mentioned, through the CCM, which is causing some of those delays. But these graphs by each of these municipality is available in the PowerPoint slide that will be uploaded shortly after my presentation. And everyone can have access to those slides, but as making it available on our website, we expect to see that shortly. So as we can see in each of the municipality, Windsor definitely have seen a huge spike in the month of July, but it's now trending downwards. And overall, as we are looking at the 7-day moving average, it has gone significantly down, and it's well below the provincial average. This is what the picture looks like with Amherstburg, with the low number of cases. It's obviously it doesn't give a lot of information on the slide, but just wanted to present that the number of cases, what it looks like overall. This is what it looks like for the town of Essex. For Kingsville, which has seen again a large number of cases in the region. And that's what the graph looks like. Overall, we have seen some spikes in the month of July, and then the cases are trending downwards, pretty much up to a level which is significantly below the provincial average. Similar picture in Leamington, with a huge spike in the month of end of June, and then some activity throughout the month of July, with one spike in the month of August, but otherwise generally it's also in the right direction. Looking at the town of Lakeshore, some activity, but overall it's trending down as the moving average. This is what it looks like in LaSalle, with a low number of cases, and Tecumseh. So here we are looking at how our cases are acquired COVID, starting from the last month or so, from July. We see that early on it was imported to Windsor-Essex via travel. In the beginning of our COVID cases in the community, but then we have seen some activity in the community with predominantly spread through close contacts, and now what we are seeing is some of these cases are acquired through travel again, which is pointing out to the fact that people are traveling and people are crossing border. Some of them are essential workers, essential visits, but other people are also crossing. So please be mindful every time you're crossing border. The community transmission is very different in Windsor-Essex compared to what we are seeing in Michigan, Detroit. So please be mindful of your requirement with respect to Quarantine Act and your advice and your need for self-isolation and keeping yourself safe and your family safe. Looking at the exposure history among agri-farm workers specifically, we have seen a lot of these cases coming in through close contacts, but more recently we have seen some workers coming into the country and then were tested positive during the time when they were isolating. Among the non-agri-farm workers, this is what it looks like. Most of these cases that we are seeing right now is in close contact, and very few with travel. And the community transmission, at least in the last week or so, has been very limited to none. Looking at the COVID-19 cases by healthcare worker status, about a quarter of our cases are worked in Michigan, while the rest of the workers are local workers working in long-term care home settings, retirement home setting, and other healthcare settings. This figure looks at the number of COVID-related hospitalization and patients in the ICU on any given day, and include both new patients as well as existing patients with COVID-19. Cases in the ICU are about two for the past week. The red line indicates the 7-day moving average in the ICU, showing stability in the past 7 days. Hospitalizations have fluctuated more so than ICU. We're seeing a decrease again to what we have seen towards the end of July based on the 7-day moving average, but still it is relatively busy for and a lot of admissions related to COVID. Looking at the overall health system capacity, this is what it looks like. The orange line indicates the occupancy rate of our acute beds. The threshold is to have the occupancy rate below 85%. And at this point, we are not meeting that target. This signals that we could be stretched from a capacity perspective if we see sudden increases of COVID-19 in the community. And just to reiterate the fact that this particular graph is showing as an overall system capacity and not necessarily with COVID only. So that means there are other patients who are sick and who are occupying the beds of our acute care hospital beds. The green and dark line are representing ICU capacity and ICU ventilator beds respectively. For ICU capacity, we'll look at the overall ICU capacity and ventilator beds. While there is no established threshold, we aim to have 50% or less ICU beds occupied. And again, same thing, it's indicating that the ICU beds are occupied more as well, and indicating that there are there could be some challenges with respect to health system capacity to deal with other cases in the community. So where are we with all these cases? The good news is almost 94% of our cases are resolved, and only under 3% of our cases are currently self-isolating. Unfortunately, we lost 3% of our cases in the community. And looking at the age and sex breakdown of COVID-19 deaths in our community, we can see that more females died as compared to male. And from an age distribution perspective, almost 70% of the deaths were in individuals who were 80 years and older. The youngest person who died in our region was a man in his 20s. Looking at the overall case fatality rate, our case fatality rate continues to be lower than the rest of the province, both in the long-term care home sector as well as in overall community setting. The general direction, what we can see as a country is that we're moving in the right direction, with our case doubling rate continues to increase, which means that's a good sign that there are not many people who are acquiring new disease every day. In Windsor-Essex, we have seen significant spikes in or decline in the case doubling rate, which is obviously we have seen in the month of June and in the month of July, but now we are all trending in the right direction, with the either compared to the provincial average and at times better than the provincial average. We're not showing the R naught slide as the data is unreliable to say at this time, and we will present that information next week. Overall, what we can say is that the median rate is still below 1, which is indicating that overall there's a decrease in the transmission in Windsor-Essex. Overall, as we also know that we are seeing a general decline in the number of cases in the community, and the primary exposure continues to be a close contact with a confirmed case. But it is important that we identify that many of these individuals, they need to reduce the number of their close contacts. What we have seen, what we have issued the alert today, is an indicator of people being more responsible, taking the time to stay home when they're sick, and reducing the potential number of close contacts to limit the spread. COVID-19 related hospitalization and ICU are low, but overall as a system, when we are looking at the acute care beds capacity, ICU beds capacity, it is coming to a point where it's where we like to see it is increasing, which is triggering a need to look at our health system capacity at this time. And I already talked about the weekly median R naught, which is below 1, but we'll present more details once we clean up all the data. Thank you.
The conference is now unmuted.
So we'll now take questions from the media. We'll start with CBC.
Hi there. So Toronto Public Health identified 100 schools that are more at risk of spreading COVID-19 in low-income areas. And I'm just wondering if Windsor-Essex Public Health is doing something similar.
At this point, we have not done that. There are a number of ways to identify some of these neighborhoods with high risk. We haven't done that at this point.
Is that something that you guys will be considering or discussing?
We will be talking to the school board to see if there is anything that we can support them in identifying these schools. I'm sure that we have had some conversation with the schools, and they have their own criteria to identify some of these high-risk schools. But I think the key question would be what would be different for those schools compared to the rest of the schools, and how we can provide additional support. Some of these operation is linked with the school board, so we're hoping that it's something that I think we can support, and we will help the school board in making that determination or identifying specific support for them. So we'll be interested in talking to them about it.
Okay, that's all for me. Thank you.
Any questions from AM 800?
Hi, yes. You may have seen circulating online the Facebook post about a restaurant that is planning on allowing people in with no masks, and reports of a lot of the staff not wearing masks as well. Just wondering if you will be following up on that by having bylaw officers there this weekend, or if you've looked into this.
I don't have my director who provides me with some of those details, but something that we can definitely pass it on to our enforcement officers. I'm sure that they are on top of every complaint that we receive, which I may not be aware of, but they are on top of everything. And if not, then we'll definitely make sure that they are following up with the establishment and make sure that they are following the order that is already issued. And again, not only just the order, there are a number of bylaws that is already issued by various municipalities, and we hope that all of those things are being followed. And if it's a matter of education, we can. If it's a matter of enforcement and issuing fines, we'll do that.
Okay, yeah, just because in the post, the owner of the restaurant, and then he also spoke on AM 800 this morning, saying that, it was his personal beliefs, and he's a private business owner, he should be able to do what he wants, such a thing. So are there still grounds then for the health unit or for municipal bylaw officers to levy fees against that?
Absolutely.
Okay, thank you.
Any questions from Blackburn?
Yes, a couple. So the alert that you sent out regarding the 3 locations in, 2 in Kingsville, 1 in Harrow, was this a patron that went to those 3 different locations?
Yes, that is correct. So it is one of the community member who went to all these locations, and they're positive, and we believe that they were symptomatic when they visited these facilities.
So if no other staff or customer is infected, would that be a sign that these restaurants are, taking all the necessary precautions to protect their staff and patrons? I mean, I know it's still too early to say, but if nothing comes out of this, then that would be a good sign that these measures that we're taking are working?
Well, I believe so, because I think there are a number of measures that we talked about, including physical distancing and the requirement to wear a mask in these commercial establishments. So all these are there to protect everyone. And if we're requiring that, that means even if someone who is sick visiting these facilities, the risk of transmission would be low, and that's the hope. But we felt that, because of the potential exposure, it is important that everyone who visited the facility, because things happen, and there may be even a small lapse in all these control measures. It can trigger, or it can potentially put someone at risk. So it's always good to be mindful when you are visiting any public space. So first of all, the responsibility on the individual who is having symptoms, that they should not visit any public space if they are feeling any symptoms, or if they're not feeling well, they shouldn't go out, period. And then for the rest of the community, if you are seeing someone who has symptoms, please try to keep your distance at all times. And that goes not only in the commercial establishment, but even in your social settings. If you're seeing someone who is not feeling well, please stay away, please maintain your distance, and try your best not to be in that close contact zone for any individual at all, even with your social bubble. Like we say, you can, but it doesn't mean that you should do that all the time. You should try and maintain your distance as much as possible, but there will be instances, especially with your close circles, that you will say, I can maybe shake hands, I can maybe come close. So you can do that, but just being mindful that there's always that risk. And especially for people who are symptomatic, please, I request them, please stay home until you are cleared for COVID, or if your symptoms resolve, because if you're out there while you're symptomatic, you're putting a lot of people at risk.
And if community transmission is limited to low, is that a good sign as kids head back to school, that at least there's only 64 active cases and community transmission is low at this point?
Absolutely, and I think that's what we're talking about, having all these multiple layer of controls and measures in place, because if there is limited activity, limited transmission happening in the community, the likelihood of a child or a staff person coming to school sick will be significantly low. And again, that's why the baseline rate is critical. And if the baseline rate in the community increases, that means the likelihoods of a child coming into a school setting would be high. So that's why I think it's important to keep a close eye on all those community transmission, and also breaking it down into with the details and knowing more and more about these cases and contact, and take appropriate immediate actions on all those cases would help to prevent any further spread. So that's the hope, and we feel that even when we're talking about the responsibility as a parent, as a child, as a community member, if you are sick, please stay home, because then you're not putting anyone at risk. And especially it's important when you're talking about the schools and the children going back to school, that if you feel that you are sick or you're not feeling well, please stay home. If your child is not feeling well, if they have come in contact with someone, please stay home. And even when you're talking about your child, I think it is also important that you need to have a good conversation with your child as well, with respect to their social contacts as well. You want to know who they're coming in close contact with, and how you can prevent that from happening if it's the same group that they're hanging out in the school, versus if it's totally a new social contact that we're talking about. So I think all of those things are important. And if the community transmission is low, it definitely has a positive impact on children attending school. And we hope that everyone is doing their part to keep our community safe, keep our children safe.
Okay, I'm sorry, one more question. Just been looking at the number of recovered versus the death rate. People see that and are still continuing to say like, oh, you know, most 94% of people are recovering. But do you have a figure of how many people needed hospitalized care or were hospitalized but have since recovered, that are now in the recovered bubble but actually needed hospital care or even ICU care? Do you have a percentage of how many cases needed hospital care overall?
So I think overall, I have to double check. I don't have my epi, but maybe we can let you know what that overall number look like. I have a number of 0.2%, but I am not entirely sure that if it's just the current number of cases who are in the hospital. I believe so, but something maybe we can circle back and let you know the exact proportion of people who visited who needed hospitalization at some point during their clinical course. And again, most importantly, if we can have that information, if there's any way to capture that information or not. So we'll try to circle back with you on that, and we'll provide you with that information.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Just to be clear, the individual who visited those establishments in the county, they had symptoms but didn't know that they had COVID and then later tested positive?
That is correct, yes.
Okay, and can you tell us, I don't know if you're allowed to say, what symptoms that they may have had when they visited? Did they have a giant cough or did they have the sniffles? How bad was it when they went out?
Well, I think it really depends on, like sometimes even with mild cough or mild sniffles can cause the transmission, and I think it would be hard for me to say. I don't have the case details right in front of me, but all I can say is they had symptoms, even mild. They shouldn't go. I think that's the message that we're saying, that we're in stage 3. Yes, there's limited community transmission happening, but it's just a matter of being more responsible. If you're not feeling well, if you're having symptoms, it's better to stay home. It's in the best interest of yourself and also in the best interest of your community. So I wouldn't try to make a differentiation whether the symptoms were mild or very severe. I would say if you have symptoms, if you have any reason to believe that you're not feeling well, try to limit your outdoor activity as much as possible.
Thank you.
Any questions from Windsorite?
Good morning, Dr. Ahmed. You mentioned twice that ICU capacity is not where it should be. What do you think the challenges are there for local hospitals? Obviously, those cases are not necessarily COVID-19 related, considering there's only one case, but what do you think the challenges are with building that ICU capacity locally?
So as we mentioned, the ICU capacity is close to 50%, which is, again, we like to see more ICU beds available for people who need it. And as you rightly mentioned, it's not necessarily linked with COVID, but, post-op care, people coming with a large MI, myocardial or heart failure, or like any other significant condition which requires ICU care. So I think it's just a function of the entire system. It's not necessarily bad that we have a bad situation at this time, which is a concern, but it does show that the capacity is limited, and if there's a big surge, then we are in a situation. So I think it's just being prepared for what to come and ensuring that as a system we're keeping a close eye and take actions as needed in a timely manner.
Okay, thank you.
Any additional questions from CBC?
Yes, hi, Dr. Ahmed. I just wanted to ask, those 3 locations that person visited, those are all restaurants, correct?
Yes, so there are 2 restaurants, and then the last one is a vineyard, Musketeer Vineyards at County.
Okay.
Yeah.
And do you know at the restaurant if they were dining indoors or was that outdoors on a patio?
I don't have that information, I'm sorry.
Okay, that's all right. Thank you so much.
Any additional questions from AIM 800?
No, thank you. I'm good.
Any additional questions from Blackburn?
No, thanks.
Any additional questions from Windsor Star?
No, thank you.
Any additional questions from Windsorite?
No, thanks.
Thank you, everyone.
Thank you.